Now, we're going to start talking about the actual system. We want to start at the beginning, right? Any good story, you want to start at the beginning. Unless the ones that don't start at the beginning, then those are really complicated and try to follow. There's a really good movie that does that, and maybe it'll come to me by the time we get done at the end. Okay. So we're going to start in the oral cavity. First, we're going to talk about the functions of the oral cavity. So sensory analysis, determining if there's food, there's some touch, there's some taste, and stuff like that before it comes in. There's also mechanical digestion. There's the manja chewing part, right? Also, your tongue and your palate surfaces are going to help sort of break that stuff down also. Lubrication. There's some mucus going on. Mostly it's going to be saliva, help moisten things, move things along, and stuff like that. Limited chemical digestion is also going to be taking place primarily with your carbohydrates and some of your lipids. And we're going to mention those proteins here in just a second. Here's a picture of some of the structures of the mouth. To point out your tongue actually takes up a pretty significant portion of that, which we'll show in another picture. The dangly thing in the back is the uvula, which is kind of actually important for the swallowing reflex. You've got these other like flaps, for example, called the frenulum. If you look, you can kind of see mine right there. That's my frenulum with my lower lip. And I have one underneath my tongue and also on your upper lip. And if you've ever jumped headfirst into water from a very great height and you had your mouth open, you may have split those. It's kind of painful, but it heals pretty quickly. Let's see. We got some tonsils in there. We got some other arches, the palatoglossal and the palatopharyngeal, which are also part of that swallowing response, which we'll talk about here in just a second. Talking about the tongue's kind of important. It's got 4 major functions, okay? The first function is to help mechanically digest by compressing, abrading, and disorting your food, kind of mashing it around and stuff like that. Manipulating food to assist chewing, to help move it around to your teeth, from your slicing teeth in the front to your grinding teeth in the back. It's also got some sensory taste, of course, touch as well, temperature, especially if you've ever burned your tongue, you'll know about that one. You know, whoa, I need to stop. And also secreting mucins, which are types of mucus-type compounds, and lingual lipase, lingual being like mouth or tongue. Lipase, ACE at the end, tells us it's an enzyme. Lip at the beginning tells us it's responsible for working on lipids, right? I guess you could call it lipase, but I think technically it's called lipase. So here's another picture of the mouth and the tongue. You can see the tongue makes up a huge part of your mouth. There's a lot of musculature going on, a lot of fine movement and stuff like that. Some other things to sort of point out, the gingiva right here, that's basically your gums. So take a look. See, right there, the pink part underneath my teeth. If you've ever had gingivitis, that gets inflamed. Itis means inflammation of something. We've also got the palate in the back. So bony, hard palate, tissue, soft palate. You've got the uvula, the dangly bits down at the back. Something else, it's kind of a cartilaginous looking structure, is the epiglottis. That's that little flap, basically. Normally, it is open, right, allowing air to pass into your trachea. But when you swallow, this is why it's important not to talk while you're eating. When you swallow, the epiglottis closes, restricting access to your trachea so food doesn't go down your throat, to your breathy throat. It goes down your foody throat, which is behind your trachea. And we'll take a look at that in greater detail also here in just a second. So, moving on, within your mouth, something super important is your teeth. And so there's a lot going on with your teeth, and your dentist would be a good person to talk to tell you all about that. They love them some teeth. So they assist the tongue in chewing. That's their primary purpose. They've got a lot of stuff going on. One part, they've got this bony matrix right in here. This part is dentin. It's very similar to bone. That's where it gets a lot of its strength. Inside of that, this part right in here You've got something called the pulp cavity. It's the soft part where all the vascular tissue is and stuff like that. Going down from that, the roots, that's this part down here and here. That's basically how the tooth anchors itself into your jaws, your upper jaw and your lower jaw. There's a layer of cement that actually holds it in place. And you do have a ligament there because you can kind of think of it as bone to bone together, and it's called the periodontal ligament. You can actually bruise that. I did that about 6 months ago. And so it creates a gomphosis. It's a strong articulation, kind of like a joint. You've got the crown, which is the top part. That's the exposed part of your tooth. If you've ever had a crown put on, I don't know if you can see, you can't really. I have a crown. It's a gold crown. So, I mean, I guess if I get hard up for cash, I can just pop that sucker out and I can get like 50 cents. The crown is the top part right here, and the crown is covered in the white part of the teeth that you can see. That's the enamel. That's what gives it its strength and resiliency. And it forms the biting surface, the occlusal surface. You've got cusps up at the top of your teeth. You can kind of see it right there, right? And those are just raised portions. You can see, like, there's an example of one right there, that are increasing surface area, creating jagged edges to sort of help with that mashing, grinding texture and stuff like that. Keeping on. We've got different types of teeth. So we've got 4 types of teeth. The first one is your incisor. Those are your front teeth. Then you've got your canines. Those are the pointy teeth on the side here. You got your premolars, kind of these ones, and then your molars, which are in the very, very back. Incisors are cutting, slicing teeth. Canines are your cuspids, are your tearing, gnashing teeth, right? Premolars or bicuspids are grinding, tearing. And then your molars are your mashing, grinding teeth way in the back. To have that good surface area to sort of really mash that stuff flat, ground those bigger chunks into smaller chunks, and then get them ready to swallow in the back there. This is a sort of breakdown of your teeth. Now, you actually, as humans, we've got 2 sets of teeth. Between the ages of about 7.5 months or so, maybe a little bit earlier, maybe a little bit later. Like in my son, they came out a little bit earlier. Up to about 2 years old or so, give or take, you have your deciduous teeth. Deciduous refers to growing in and then getting rid of. Think of oak trees, right? Maple trees, they lose their trees in the fall. So those are deciduous trees. Your deciduous teeth. They're also known as your primary teeth, your milk teeth, or we most commonly around here call them your baby teeth, right? They're temporary teeth. You have about 20. And they will eventually fall out. And then you get mad bang from the tooth fairy. This is actually a cutaway, and honestly, to me, this is one of the most horrifying images that I've ever seen in my life, and it will haunt me for the rest of my days. Some other people think it's super duper cool. To a certain extent, it is. What they've done here is they've cut away the mandible and the maxilla, so you can see those permanent teeth. That's the second set of teeth that you get, developing in the jaw, and then they actually push their way out. Underneath the erupted deciduous teeth. Those are the ones that are exposed. And so eventually, as you're getting older, those teeth start to loosen up and they fall out to make room for those permanent adult teeth, your grown-up teeth, whatever you want to call them. You actually have more grown-up teeth than you do baby teeth. You've got high 20s, low 30, I don't remember. Those start coming in. Your front ones come in first, going back to what we lovingly call your wisdom teeth, starting about 17, 18, going into 20s. A lot of people have to have those removed because your jaw's too small. I had to have all my wisdom teeth removed. I guess I'm not wise anymore. So something else, moving away from your teeth that we had talked about, super important are your salivary glands. You've got 3 sets. They come in pairs. You've got your parotid, which is right here, sublingual sub being underneath, lingual meaning tongue, so under the tongue. And then your submandibular, right? Sub is, so it's kind of down towards the bottom underneath your jaws and stuff like that. Each set of salivary glands are structurally different and they make different saliva. That's about as far as we're going to go into that. Speaking of saliva, though, we are going to go into that a little bit more. Saliva is super important. You also make a lot of it, 1 to 1.5 liters of saliva a day. That's like a quart, between a quart and a half a gallon of spit. That's gross. Most of that is from the submandibular glands, the ones that are farther down right here. Another big chunk is from the parotids back in the back, and then a teeny tiny bit that's from the sublinguals underneath your tongue. Mostly it is water, the vast percentage of it is water. The remaining 0.6% is a whole bunch of stuff, enzymes, electrolytes, buffers, antibodies, waste, loads of stuff that it's in there. Primarily, it's cleans oral surfaces, right, because of all those antibodies and stuff like that, helps remove that bacteria. It also moistens and lubricates food, getting ready to just swallow it. It keeps your mouth pH around 7, so if you're eating some lemon juice or you're eating something really bitter, that's probably going to be pretty basic. Your saliva is going to help sort of neutralize that, because we don't want things to get really outside of 7. Most places can't really handle things too acidic or too basic. Also helps control bacteria. Why we get cavities is because you got bacteria on your teeth and they eat a lot of sugar. So if you have a high sugar diet, they turn that into acid and it starts to dissolve your teeth. That's where cavities come from. It also dissolves chemicals that stimulate your taste buds, and you're just like, wow, that's super tasty. And the main enzyme that we talk about in saliva is salivary amylase. Amylase breaks down complex carbohydrates like starches. Something that's pretty cool to try, and maybe it'll work for you. Sometimes it does, sometimes it doesn't. You get a piece of bread or a cracker or something like that, a little piece of pasta. Put it on your tongue. And then as you salivate and you sort of work that little piece of food in your mouth, it kind of starts to take on a little bit of a sweetness, like sugar. And basically what you're doing, that salivary amylase, is breaking those complex carbohydrates down and turning them into simple sugars that we actually taste. So that's kind of cool. Part of what the mouth does is it also gets food ready by chewing. The technical term for chewing is mastication, not to be confused with something else that is socially unacceptable in most places. But mastication is relatively acceptable. Try not to do it with your mouth open. It's generally okay to do it in public. And so basically what you're doing is food is sort of moved around and eventually forced back away from the vestibule, which is sort of this space here in the front, to the back across the occlusal surfaces of your teeth. Muscles for mastication will move your jaw up and down like this. Also move it side to side, so when you're chewing, kind of doing that, you got this sort of circular motion going on. The tongue is also going to compact the food as you're chewing it into that bolus and start to move it back towards the back of the mouth, making it easy to swallow. Which then is going to get us into the pharynx and the swallowing reflex. So your pharynx actually has 3 parts, right? It's a common passageway for food, liquid, and air. The top part is the nasopharynx, naso referring to your nose or your nasal passages. So that's the part that's directly behind. If you were to go like this and just go all the way back, you would hit the back of your nasal passages and then it would curve down into your throat. We don't want food up there. Food shouldn't be going up there. The oropharynx is basically the back of your throat, like that. That's where the food is going to go. And then we've got the laryngopharynx, which is the lowest part, talking about right here where your epiglottis is. Right here is my trachea. Right behind that is my esophagus. And then I'm going to go down past all of that stuff into the actual esophagus proper. So Speaking of our esophagus is a hollow muscular tube that moves food from the mouth to the stomach. It's about 25 centimeters long. That's 3/4 of a foot or so. 2 centimeters wide, so not that big. Like that, maybe. It enters the abdominal pelvic cavity, because remember, the different cavities have membranes that section them off from each other. And so basically there's a little hole where your esophagus goes through your thoracic cavity into your abdominal cavity. It's called the esophageal hiatus. Let's see. We talked about the esophagus' musculature. Now at rest, your esophagus is closed. Okay, that's to prevent air from entering, but it's also to prevent food from coming back up. Talking about the histology of the esophagus, the walls have 3 layers, not 4. The mucosa, the submucosa, and the muscular layer. We don't have that serosa. It's kind of outside of the peritoneal cavity, and so we don't have that peritoneum creating that serosa layer. How are we doing so far? The answer is great. So, deglutition. That is swallowing. So after you have masticated that delicious piece of whatever food you just put in your mouth, you are going to deglutite it. I don't know. I'll get back to you on that one. And so it's initiated voluntarily, or it can be, but once it reaches a certain point, it is involuntary. It happens automatically. So basically, it turns into a swallowing reflex. Once you get it started, there's receptors, tactile receptors that'll touch, boop, 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 on the palatal arches. There's arches in the back of your mouth. And the uvula gets stimulated when that food gets pushed up against the back. That's going to send information to the swallowing center in your brain, your medulla oblongata. For those are Waterboy fans, is, right here, remember, base of your skull, right? A little bit higher, maybe. There's 3 phases of the swallowing reflex. And so it kind of goes like this. In the buccal phase, it's up at the front. So basically what's going to happen is the tongue is going to compress that bolus up against the soft palate, those palatal arches in your soft palate and your uvula. You're going to seal your soft palate's going to move up, sealing off your nasal passages. You don't want food going up in there. If you've ever had food go up your nose, sucks. Don't do it. That's going to put the bolus into the oropharynx, the back of your throat. And then it's also going to put pressure on the epiglottis, which is going to seal your trachea so food doesn't go down there. At least it's going to start that. And then we're going to begin moving that bolus downward. That's going to get us into the pharyngeal phase. That's going to continue to close the epiglottis, restricting access to the larynx. The uvula and the soft palate is going to continue to keep your nasopharynx blocked off, and your bolus is going to start sliding down. If you look right here, give it a second, down your throat like that. Then moving on past that is the esophageal phase, where this peristaltic contraction is going to take place and start moving your food down your esophagus. If you notice, it makes like a bulge, and then as it passes, like right here, it closes and stays closed.